present to you are quite familiar with you. It's no this. I have used with a dentin instead of any other biomaterial existing. Here you can see the case of the periodontal disease of lower jaw, actually all around the mouth periodontal disease, and grade 4 mobility of 4 lower incisors, which have to be extracted. You can see the slide before, slide after the instruction, and panoramic view. Extracted teeth in this case are prepared by dental assistant during the session of the surgery. You can see the teeth before mechanical cleaning, and after mechanical cleaning we are strongly recommend to use with tungsten bar, because a tungsten bar cleaning the surface of the teeth by chipping and not create the high temperature, which can affect the collagen inside. You can see the graft after preparation, and the graft in our jar we provide with our set. 2 implants have been placed through the sockets. Surgical site was augmented by autologous dentin graft. In this case, which in my opinion, in our opinion, the best membrane existing today, biological, and again, in my opinion, much better than any other membrane. So you can see the interface between graft, dentin graft, and bone. It's the same session here. This X-ray, it's after 2 months. And after 2 months, in my experience, we got already very strong connection between bone and dentin, between bone and graft. And if we do delay loading implants, you can feel the good resistance when drilling. Here we can see the very similar case with the periodontal disease, but in addition, we can see here the periodontal, endoperiodontal abscess, and over here we can see here some kind of radiolucency, which could be a cyst, which again, in this case, 4 lower incisors were extracted, prepared as a dentin graft by our method. You can see here the shape of alveolar ridge, and after 2 months, and the cyst site was enucleated using by a lateral window, from back a lateral window. Apicectomy has been done here, and all this was filled by autogenic dentin, made from 4 lower incisors. In this case, we can see the very usual picture that you, I'm sure, encounter in your everyday clinical practice. It's the wisdom tooth, unrestorable one, with the deep caries, and the patient wish not to restore but to extract. And after extraction, doing our method, putting into the socket, we not only preserve the height and width of alveolar ridge, but also we protect the distal root of the second molar, which in such a case almost always gonna lose the attachment tissue. And here you can see the slice of CT scan after 2 months, where we can see the very dense and strong alveolar bone dentin interface. In this case, we can see the lesion the apical lesion at the root of number 26, upper right molar, where you can see here clearly the oral antral communication. We can see here the orifice of this communication. The tooth was extracted, and here you can see the tooth after mechanical cleaning. 2 months after grafting. From the first time, I by myself couldn't believe that after 2 months after grafting, we've got, in this case, we just add to our procedure some heating process, which can store it in a dry environment, not in the freezer, for as much as he can. It doesn't matter because it doesn't affect by anything, because the graft is very well protected by mineral. So that's what we wanted to show. And this is from Confucius, that said that I hear and forget, I see and I remember, I do and I understand. Again, all of our procedure, and for now, thanks for your attention.